Okay, so hello everyone. Welcome back to Orthopedia by Dr. Keir. And this video today is on 3D printing in orthopedics. It is a very important question since 3D printing is now very well in the market and it is being used by many high quality centers. So 3D printing in orthopedics is a very important question in both MS as well as DNB, and you need to know how to write at least a 10 mark answer on this. So this is what I'll be demonstrating. You first start with the introduction, just write a single line on what is basically 3D printing, and then you go on to explain the principles of 3D printing, because you have to write about the principles at least one line. These are the three principles: additive manufacturing, customization, and material selection. So basically you take the material of choice, you customize it based on the patient's need, and then you keep on adding this material layer by layer to form a 3D object basically. So these are the three principles which are very important to mention. Then you will mention the procedure. The procedure will start with imaging and data acquisition, wherein you will take high resolution CTs and MRIs to gather the data about the patient. And then you will create a 3D digital model using various specialized softwares. You have to mention the name, Mimics and 3D Slicer. And after that, you will design according to the patient's need, and then you will do a simulation whether the design that you have created is working for the patient or not, and then you will go on to 3D printing. So this is done using various techniques. Three names you need to mention in your answer at least. One is the selective laser sintering, fused deposition modeling, and stereolithography. So these three names are very important to remember. And then once the material is made, then you need to send it for processing, and after that you just send it for clinical application. So this is the procedural steps that you need to remember. And one extra tip is that you can write this in the form of a flow chart, so it looks very beautiful and you'll get extra marks. Then you have to go for the applications, and this is very important. The application of 3D printing in orthopedics, you can mention that it is used to make custom implants, prosthetics, surgical guides and models, basically for pre-operative planning. You will make the model of an acetabulum with the or a pelvis with the fracture that is there in the patient, so that you can decide what to do intra-op. You can make 3D printed scaffolds where you can insert bone grafts. Then you can make spinal implants, 3D printed cages, and in trauma and oncology you can make basically prostheses, 3D printed prostheses which can be used for limb salvage surgery. So these are the applications, and this is very important to write. Lastly, you can just mention the limitations, that there is a high cost obviously which is attached to it. It is time consuming, and there are many regulatory challenges which are seen because they are not yet regulated very properly. Then there is material limitation, and obviously because it is a new and an evolving technique, so there is limited long-term data. You can mention these limitations, and as I said, you can make a flow chart for procedures, and this will be more than enough for a 10 to 20 mark answer. All the best, and see you in the next one.